Well, good evening, everyone. We went to a couple webinars in the last little while, and weight management is one of the toughest strategies. And some people feel it's a disease of the brain. There's been over 8,000 genes that have been identified, and they're pointing that the brain is very involved in appetite. And our population is growing in size. And depending how you want to look at this, up to, well, first of all, more than half the world is overweight at this stage, and that's a huge change. And if you want to look at, ideal health, and over 70 to 80% of most adults are metabolically in trouble or are overweight. And, the gene pool hasn't changed, the environment has changed. So we have this interaction with the environment and gene therapy. And so we have a lot to talk about. So we're going to actually talk about how we can take the conversation away from being hungry all the time and gives you the opportunity to work on diet and lifestyle changes. Um, and and so I'm really pleased that we have new agents available, and we're going to talk about Mounjaro, which affects two gut hormones versus Ozempic or semaglutide that affects one gut hormone, and there's actually medications that affect three gut hormones that are coming of age. So there's lots to talk about. But these medications are not cost effective. They're expensive, and but there's ways to making them much more uh, cost effective and to do strategies. And we've been doing that for quite a long time. That's counting clicks. Ruhi's been our expert at this for a long time, and we're going to explore these opportunities with you. And we have a series of videos, and you're gonna get a headache when it comes to maths and things in nature, but we're going to show you lots of things to talk about it. So take it away, Ruhi, and tell us about where this might fit into your repertoire.
Absolutely. So, as Dr. Curnew just mentioned, obesity really is a growing public health crisis, and projections suggest that its prevalence is going to continue to rise. And this surge is really driven by a combination of, a sedentary lifestyle, increased caloric availability, and even socioeconomic factors. And when we really consider this trajectory, obviously scalable and effective interventions are urgently needed. So, Mounjaro, also known as Trizepatide, with its proven benefits in reducing body weight and improving metabolic health, it really offers a promising tool in both clinical and public health efforts to address this crisis, particularly when combined with lifestyle and behavioral supports, as we will continue to mention. So, next slide. Obesity is a complex and chronic disease. There are multiple of those contributing factors: genetic, behavioral, physiological, epigenetic, sociocultural. And, this multifaceted origin makes it clear why interventions focused solely on diet and exercise often fail in the long term. Treatment has to be multifaceted too. So, evidence from, again, as Dr. Kearney mentioned, those genome-wide studies and epigenetic analyses have shown that individual susceptibility to weight gain can really vary substantially, and these differences are not easily just overcome by willpower alone. So medications like tirzepatide, they target the physiological dysregulation at the heart of obesity, particularly those hormonal imbalances involving insulin, GLP-1, GIP, leptin, and ghrelin. By modifying the body's appetite and energy regulation pathways, Mounjaro offers one of the most potent biologically informed approaches to treating obesity, and not just its visible symptoms. Next slide.
It's kind of interesting what you talk about is that we are growing as a population. Um, and I get being hungry, but when you hear numbers that 70% of caloric intake are being consumed by processed foods, and processed foods are designed to light up dopamine in your brain and to make you crave. And I think we can think of food as addiction. I think of sugar as a derivative of cocaine. I'm a craver of sweets and bread. And you hear numbers that 25% of adults are doing enough exercise, 25%. And you hear from experts on longevity, um, that we have to lift weights, we're losing our muscle mass, and have to do resistance training, and most people just don't do it. Um, and I'm really surprised is that how do we change that? And as I get older, as I now become a senior citizen, I'm noticing that I'm not as strong in many ways, and I'm really working hard at this. So I'm trying to devote somewhere between 7 to 14 hours of serious activity. which includes balance training, aerobic training, weight training, and really, Dr. Attia, an expert in longevity, says it the best. If you're not prepared to lift weights, um, then get old. And 25% of us are ending in a nursing home. And is that is if you make it to 65 years of age, you have roughly 20 years of life left, a little bit long, an extra few years if you're women compared to a guy. And if I'm about 65 plus, is that means I have 20 years left. 10 years are going to be good years and 10 years are going to be present with illness. That's the average. None of us are average. We want to escape the averages, but these are realities. I'm thinking there's so much you can do, and how much you weigh, how much you exercise, what preventive strategy you take are so important. And I get being hungry, and I get how difficult it is, but it's this combination of all these areas, and Rui and Morgan and Rad, you all been instrumental in helping us um, navigate these complex issues. And if we just say government should pay for these medications, in my mind, they're not cost effective at their current pricing, and but we can actually reduce the cost to maybe 25% of what it can be. And if you use them smartly, it can be even less than that. So it could be $1,000 a month, or it could be $50 a month for weight loss medications, and we can do it smartly. So we're going to explore that with everybody. So let's look what we can do. Um, and I agree, there's a lot of genes involved, and there's lots of things to think about, but there's also things that we need to do as individuals too as well. That combination, all the above. So tell us more.
Yeah, absolutely. So, of course, lowering your HbA1c is strongly correlated with a reduction in diabetes-related complications. According to even the United Kingdom prospective diabetes study, every 1% reduction in HbA1c is associated with a 21% reduction in diabetes-related deaths, a 37% reduction in microvascular complications, and a 14% reduction in myocardial infarction risk. These benefits extend across multiple organ systems, and they contribute to prolonged survival and an improvement of quality of life for patients who do live with diabetes. So, Mounjaro's efficacy in lowering HbA1c has been shown to exceed that of established treatments. The Surpass 2 trial, Tirzepatide 15 milligrams reduced HbA1c more than semaglutide 1 milligrams, and we'll look into some of that data a bit later in the webinar as well. And similarly, when we look at weight loss, it's another major clinical advantage. Patients in the same trial lost up to 12.4 kilograms on tirzepatide 15 milligrams versus 6.2 kg on semaglutide. So these reductions in body weight, they contribute to improvements in cardiovascular risk profiles, such as, reductions in blood pressure, improvements in HDL cholesterol, as supported by other clinical trials as well.
So it's interesting you point out these data. These are observational data. As hemoglobin A1C goes higher, risk goes up, and you can see that on your left. But Dr. Gerstein, a number of years ago, did a meta-analysis of very tight blood sugar control versus loose blood sugar control. Um, and he demonstrated that it translates to basically a 10 to 15% reduction in heart attacks, no difference reductions in strokes, no difference in total mortality. So the observation, the randomized data sets are always somewhat different, and that's my job to help guide you through this area. So the important thing is don't get diabetes, and the best way to put diabetes into remission is to lose 20 to 30 pounds and keep it off. And that's the number one priority for diabetes regression prevention. Um, and the data for these drugs in treatment of heart failure is basically a 15% reduction in heart failure. So it's not dramatic, but your quality of life, you lose 20 pounds, you feel better. Your life is better, your joints are better, your quality of life. And I had problems with my hip, and basically through physiotherapy and loading the joints and doing lots of weight training, appropriate weight training, you know, um, it makes a huge difference. And right now is that I'm still struggling with nighttime eating, but I managed to stop eating before going to bed, which is too late, usually somewhere between 10 and midnight. I try not to eat till the next day. I try to exercise first thing in the morning, and I'm euphoric in the morning. I'm tired going to the gym in the morning, but when I'm there, I'm good. And then around noontime, I start to fall apart again. But there's so many things you can do to improve your quality of life, and activity is. I think my vitamin E is vitamin exercise, and vitamin R for resistance training, and WW for weight training, and these drugs make a huge difference. But it allows you to get the conversation away from food so it can do these other things as well. So don't forget all these things together. And yeah, we all love processed food. My God, it tastes so good and they're addictive. And the food industry is not trying to say eat less. They're trying to say eat more. And so keep thinking about strategies. But these drugs are a game changer for many people. Um, but they're a game changer if you do the other things. And we have a series of videos on this, and whether or not you believe that you need a superstar on your team, but you also need the other players too as well. So play the game right. Um, and I agree with Dr. Atia is that if you're not prepared to lift weights, you're not going to age well. Period. And I think in our society, because of the amount of great food out there, it's man, it's hard to say no. But but there are ways of doing this. So I should stop rambling. Tell us more. Give us some more science now.
Just to add to what you were saying, even, it's a positive feedback loop. You lose some weight, you're able to move more, you're able to exercise more, you have more energy, so you end up losing more weight. All of those factors come together to play a huge role in that. And on top of that, when we think about these drugs and even eventually getting desensitized to some of the medications, exercise and lifestyle change act as protective factors for you to reduce your risk of regaining the weight back after taking these medications. So they're important to maintain. And even all the patients that we see at the clinic who are taking Ozempic and Wegovy, the ones that have made those lifestyle and diet changes are better able to keep the weight off and even ensure that they're able to lose even more weight than patients who haven't made those changes. So they're definitely very crucial pieces of the puzzle too. So now when we're looking into what is Mounjaro, so if we move to the next slide, Mounjaro, or as we've mentioned before, Trizepatide, is a first-class once-weekly injectable medication that has been approved for the treatment of adults with type 2 diabetes. It represents, a new generation of incretin-based therapies by being the first dual agonist of both glucose-dependent insulinotropic polypeptide, so GIP, and glucagon-like peptide 1, GLP-1 receptors. So that was what Dr. Curnew was mentioning before, that dual receptor aspect. So incretin hormones like GIP and then GLP-1 are released in the gut in response to food intake, and they play really essential roles in regulating insulin secretion. While GLP-1 receptor agonists like semaglutide, so Ozempic, have been used for years, Mounjaro's addition of that GIP receptor activity, it introduces a novel mechanism that enhances both insulin sensitivity and its secretion with added benefits in weight loss and glycemic control. So the FDA approved Tirzepatide or Mounjaro for type 2 diabetes in 2022 following the success of the SURPASS clinical trial program, which demonstrated superior efficacy compared to placebo, insulin, and even semaglutide. The drug is administered again subcutaneously once per week using vials and now a pre-filled pen, which has become available. And so for many patients, it offers not just improved glucose control, but meaningful weight loss as well, which is especially important as we've established the overlap between obesity and type 2 diabetes. If we move to the next slide. So when we eat, our gut releases hormones, specifically GIP and GLP-1, that communicate with the pancreas to release insulin. So this phenomenon is called the Incretin Effect and is essential for regulating blood sugar after meals. GIP and GLP-1 are secreted by different cells in our intestinal lining, so they're K cells and L cells respectively, and together they make up this powerful hormonal system that enhances insulin release and helps control postprandial glucose levels. GLP-1 receptor agonists like semaglutide stimulate insulin secretion, they inhibit glucagon release, and they slow down gastric emptying and reducing your appetite. However, emerging research suggests that GIP, so that added aspect that Mounjaro has, often thought to be less therapeutically valuable in type 2 diabetes, may actually synergize with GLP-1, so actually act to further improve insulin secretion and then metabolic outcomes. That dual agonism was designed to harness both pathways for a more powerful therapeutic effect, increasing beta cell function, while also acting centrally to reduce food intake. So if we move to the next slide, tirzepatide works across multiple systems in your body. In the brain, as we've mentioned, which has been now shown to have a huge part in obesity, it reduces appetite and food intake by activating regions involved in you feeling full. The central mechanism is supported by findings in the SURPASS trials, which showed consistent reductions in calorie intake among Mounjaro users. In the liver, it lowers your fat content, which is a key component of metabolic syndrome and insulin resistance. In the pancreas, it boosts your beta cell sensitivity to glucose, increases insulin secretion, and then reduces glucagon levels. In the stomach, it slows down that gastric emptying, which makes you feel fuller for longer. And overall, it enhances systemic insulin sensitivity. So, combined, these actions make Mounjaro an effective tool not just for diabetes management, but for metabolic improvement as a whole.
So it's kind of interesting. If you go back that slide there, to me, the most important property is the action in the brain. It's certainly a gut hormone, but this goes straight to your brain and says to Mr. Brain, Mrs. Brain, you're full. It works in the gut, and you eat too much, you throw up and get sick. My analogy, you're going on the 403 in rush hour, and the more you eat, the more frustrated your gut gets, and the more GI side effects you have. Um, People say to me, well, I don't want to eat anything. I have to eat. Well, no, I think you can starve yourself for a while. To me, it's like if you go fishing, if you're in a school of fish, um, you catch a lot of fish at that time, and other times you don't catch anything. So it's kind of interesting is that we work in cycles, and I know nobody um, that can actually will have a perfect weight control non-issue. I think you'll go through periods of time where life is very stressful and difficult, that you're going to eat more. Other times you can eat, it's like the Toronto um, hockey team right now. They're on a playoff run and things are going well, and your weight loss can go well for a while, but it can change very quickly. And the question is getting back on track as quickly as you can. But when you have a medication that goes to your brain and says, I'm not hungry. Man, that's nice. It gets the conversation, stops people from drinking, maybe smoking, um, and controlling their appetites and making better choices of healthy food. Everybody has their weak spots. Mine is nighttime. I'm a nighttime sweeter. I like bread. Um, I think bread, even sourdough bread, whole wheat bread, should be banned off from my planet if I could, but I'm not good at that. So please take these things really with some thought to this. And the conventional wisdom is you take this for the rest of your life. But you know what? I don't think you necessarily have to do that. You'll have periods of time where life is easy, at times life are difficult. We can figure out the best dose for you. As we talked about, these drugs can be $50 a month, or it could be $1,000 a month. And for some people, you can use it, maybe 3 times a year, periods of time, different things as well. So there's so many ways exploring this, and I wish people would just keep an open mind and try to do different things. I found the power of these medications. I found the power of group support, the power of intermittent eating, power that the people that you surround yourself makes a huge difference. So um, think about this, and I think it's been if you want to be the 70% of people that are overweight and develop joint problems, dementia, atrial fibrillation, congestive heart failure, 6 or 7 cancers, keep doing what you're doing. Um, and if you keep saying, well, I should be able to do it with willpower, and um, well, most of us can't. And I think there's ways of changing that, and maybe we have to really think about our food supply. Um, maybe there's tariffs coming on. Maybe we should have tariffs on certain foods and things of that nature, and that might be something to think about. I would love to see that happen. I would subsidize fruits and vegetables and go whole grains, and I would basically give beans away, and I would tax red meat to the hilt, and all processed food would have a surtax of 150,000% if I can do that. But that's just an ideal way of looking at that. But these drugs really work for many people. Keep telling us more.
Yeah, absolutely. So now we're going to look into the cost of Mounjaro. So to make treatment more accessible, patients in Canada prescribed Mounjaro for type 2 diabetes can apply for discounts through mymounjaro.ca. This enrollment process helps lower out-of-pocket costs and provides educational resources, including, how to use the injection pen. And for further support, the mymounjaro patient program also offers assistance via phone and email. This initiative helps ensure that financial barriers don't prevent patients from accessing these really life-changing treatment options. So the site really just asks for an attestation that you have diabetes yourself. It doesn't ask for physician proof, so the process is fast-tracked. And then it gives you a code by yourself via email, and just on the screen at the end of the survey on the site that you can just print and provide to your pharmacist after being prescribed Mounjaro by your physician. So if we move to the next slide, this is a really valuable chart that we really recommend. We move to the slide after. Oh, the one before that. I don't know why it's not. No, the slide before.
Can you tell me the title that you want, right?
Yeah, this is the slide 11. There we go, right there. Perfect. So when we look at this chart, this is a
I
really
just gotta say this, the first time I looked at this, I got a headache. So this is something we're gonna spend some time understanding. And it's an important slide. So something you have to pause and think about over here. Um, Tell us more.
Yeah, so we would really recommend taking a photo of this just for reference once this webinar is done. It's a really valuable resource, and it really shows you how you can save an incredible amount of money, both if you have the mymounjaro program, and if you do. So overall, when we take a look at dosages, Mounjaro is titrated gradually to, minimize those gastrointestinal side effects that we often see with these kind of drugs. The dose starts at 2.5 milligrams weekly, and it increases typically monthly, but as you might need, to a maximum of 15 milligrams. Interestingly, 2.5 milligrams of Mounjaro is considered roughly equivalent to a milligram of Ozempic in terms of glycemic and weight loss effects, which, suggests that even at lower doses, Mounjaro may offer, superior efficacy, potentially due to its dual receptor mechanism. But, as aforementioned, if you have diabetes, some of those insurance companies cover the medications. When we look at, this idea of counting clicks, which is something we've explored in our previous Ozempic webinar, which we really recommend you check out as well. The idea is that your doctor can prescribe you the largest pen possible. So here it would be 15 milligrams, and you can count your clicks to reach a lower dose that you would need. Without the mymounjaro.ca, for example, if you were prescribed the 15 milligram pen, but you were taking a 2.5 milligram dose, you would bring the price down from $16.40 a day to $5.36 a day, which is going from $460 to $150 every month, which we've calculated as 28 days. Now, that is not even considering the mymounjaro discount, which brings it down to an even lower price of $90 instead of $150. So that idea of counting clicks would make your pen last longer. You would repurchase that less often, and it would thus save you money.
So let's just pause there for a second. So it comes in different size pens, 2.5, 5, 7.5, 10, 12.5, and 15 milligrams. What we're saying is that you buy the 15 milligram pen and you count clicks to keep the cost down. So if you're taking the 15 milligram pen, which is hard to get at this point in time, and you take 10 clicks, um, it comes to just over $5 a day, the price range. If you get the discount from them saying you have diabetes, the price goes down to just over $3 a day. So that's cheaper than going to Starbucks at this stage. And so, and I say this in all sincerity. you can spend $1,000 a month on these medications, or you can spend $100 a month on these medications, um, or even less if you use them if you're using them once a week. So there's ways of making this more cost effective, and you can decide what you want to do. I know what I'm going to do, and so let's tell us more about how this works.
Yeah, so if we go to the next slide,
May I just add a few things, Ruhi? So
yeah,
a
of
few things
course.
that are important so with the mymounjaro.ca, the discount rates are not a flat rate. So on the red zone right here to the right, you can see that the 2.5 and 5 milligrams discounted at, so whatever your retail is, whatever your pharmacy. We have the Shoppers one here from Hamilton, and their base price retail was starting at 459, so let's say 460. 25% off is 344. And then for the middle doses, 7.5 and 10 is 35 off up to 40% off. So the percentages are not flat, and that's why we had to do a little bit of math for everyone here, and you can see that the differences, and different retailers have different pricings. Costco is different. Shoppers might be slightly on the more expensive end. Dr. Curnew, you called a friend and he got slightly less. Their deal is less at the 50 milligram dose. So this is just an example of the closest one we have to our clinic at Shoppers Hamilton. These are just examples. If you take a picture of it, you can see the proportions, but not the absolute values.
And to get the discount, it's not Shoppers or your pharmacist,
No.
is that you have to present this code or coupon by going to mymounjaro.ca, filling something online which you fill out, and they give you a coupon to that effect. And so that's something that to get now. How long this program will go on for, I don't know. But this is really what's happened right now. I'm hopefully this will go on for a long time. But I also like the fact that there are some supports too as well. And we haven't talked about the syringe part either as well. We won't talk too much about that because that's going to be phased out. But this is something that you can look at. So keep telling us more.
Yeah, so when we look at, the bottom line here, 2.5 milligrams of Mounjaro, so the lowest dose of Mounjaro at $150, which is $90 with a discount, is roughly equal to a milligram of Ozempic, which is $250 when using a 1 milligram dose. But with Wegovy, with using that pen, it would be $200. When we think about the lower doses, however, which a lot of people don't end up using a milligram of Ozempic, some people are quite sensitive to the medication, can report really great benefits specifically for weight loss, even at 0.25 milligrams of semaglutide, so Ozempic. It can be a lot cheaper, so $70 a month with the Ozempic pen at that low dose, or even $50 a month using the Wegovy pen. Again, this is with counting clicks. And those number of clicks differ depending on the pen that you're using as well. And these are all using the largest pens that are available in each of these. So the Mounjaro largest pen, the Ozempic largest pen, and the Wegovy largest pen.
Yeah, it's kind of funny when you go to the supermarket and they have 3 boxes of Tide or 6 boxes of Tide. You try to get best value for the dollar. You can do this extremely well with these medications here. So I encourage you to do that. Some people they have to renew some needles. They can buy extra needles. These clicks are not precise. Man, this is we're not cutting diamonds here. We're actually saving hundreds of dollars for you, getting good value. Um, and it works. Been doing this for years. Um, and same thing with the medications from, getting a good pill cutter can help you too as well. So keep telling us more how we can do well and do it in a more cost-effective way.
Yeah, absolutely. So we've kind of mentioned the simple summary comparing Ozempic, Mounjaro, and Wegovy, but here's a more comprehensive table. If you're a patient who maybe you've been taking Ozempic or Wegovy for some time now, and you're looking to see how, the financial benefits of moving, if you're finding you're having problems with weight loss on those medications. When we compare, cost, of course, it's a barrier and a factor in treatment decisions. In Canada, without considering our handy way of counting clicks, Mounjaro typically costs, 460 to 1,000 Canadian dollars per month, as we've shown in our previous slides. Through savings, the discount program, and, counting clicks, we can lower this to $90. Comparatively, Ozempic, when not counting clicks, is around, 250 per month, depending on the dose. But if you check our other webinar on Ozempic, we do a little bit more of an in-depth analysis on how you can save money and drop the cost as low as 67, roughly $70 a month on the lowest dose of Ozempic. And then Wegovy, when we look at that, it can be even more expensive, up to, $500 or $480 per month. But again, by counting clicks, we can bring that as low as $50 a month on the lowest dose. So each of the pens have a different way of increasing dosage. With Ozempic, you start at 0.25, you move to 0.5, then 1, and in some cases, your provider may prescribe a 2 milligram dose. With Wegovy, it moves from 0.25, 0.51, 1.72, and 2.4 milligrams. So there's a larger room to increase the dosages for therapeutic efficacy, which some people might be more resistant to the lower doses and need higher doses to reach their outcome and their goals. And that's kind of the price breakdown on the screen right here, as we can see per dose that you're taking.
This is actually kind of interesting here. So initially, these drugs were developed for diabetes to lower blood sugar, but more importantly, using them to actually lower your weight so you can exercise, eat better, and require less medications. So in diabetes, for instance, once you have full-blown diabetes, it's harder. It's always easier, and you have better weight reduction before you have diabetes. For Ozempic, the maximum dose is 2 milligrams. There's actually randomized data. If you go from 1 milligram to 2 milligrams, the cost goes from $250 a month to $500 a month, and you get almost nothing. Um, where so and yet some people will do it. I wouldn't do it. Wegovy, the same drug, semaglutide, for weight reduction, you can push it to a higher dose. And these trials are all forced titration. You don't need to always be on the highest dose. And so you can decide, and you can adjust the dose. And maybe instead of taking it, once a week, maybe I'm going to take it every 10 days or something, or I'm going to go on an all-inclusive to Mexico, or going on a cruise. I get my value for the dollar. Well, value for the dollar, don't go on the cruise. And I wish I could go on a cruise ship and only have one meal a day. I would love that plan if they would do that. But those are the times that you can think about this. So really important to think about how to do things better and find out the right dose for yourself. I happen to be quite sensitive to Ozempic, semaglutide, and some people are not, and so everybody's a little bit different. And the way you make yourself more sensitive to the drug and less side effects of the drug is by doing the other things, having more fiber in your diet, having more protein in your diet, less processed food. I find a natural way of Ozempic effect is having beans. It gets that bloating, gassy sensation. I had konjac noodles, which are basically root noodles with a lot more fiber and less calories. It gives me that Ozempic stomach upset problem if I eat too much of these other things. So there's ways of blending all this together, and it's magnificent. And if you go for time restricted eating, on average, people eat 500 less calories a day. If you have 2 glasses of water with every meal, you'll eat 500 less calories a day as your appetizer. And none of us are perfect. And I get it, but this is a way of really being smart about it.
Yeah, so here, we've mentioned a few times our GLP-1, our Ozempic Wegovy webinar that we did several months back, and it's a great one to just check out and see a more in-depth analysis of the Ozempic versus Wegovy and that cost breakdown as well. And we speak a little bit about body composition, resistance training and whatnot.
Okay, so now we're going to move on to talking more about dosage comparison. So we talked about the cost, but now we're just going to talk about a little about the different types of doses. So as Ruhi kind of mentioned, there's various doses of Mounjaro ranging from 2.5 milligrams is the lowest up to 15. And some people might choose to do various doses. They might not go all the way from 2.5 to 15. Same with Ozempic. It starts at the lowest dose of 0.25, and it goes all the way to 2. Wegovy goes up to 2.4. And it's recommended that if you're starting to take it, that you take it each weekly dose for 4 weeks at a time before moving up to the next dose. But of course, you might not move up to the highest dose. It really depends on what cost range works for you, and the effectiveness may range from different individuals.
And who's to say that you have to use 0.25 milligrams? Maybe just looking at, I have this pen that I look at sometimes, and that gives me stomach upset and cravings to decrease my appetite. So some people just need a fraction of the dose, and some people it has no effect on appetite. Remember, we're learning that there are over 8,000 genes that affect weight, and most of them are in the brain. And unfortunately, the food industry has figured all this out and have done elegant studies about. I know, like when you fall in love, your brain patterns change a lot. When you start eating and eat processed food, your brain waves and your PET imaging of the brain just changes dramatically. So, the food industry is not so much interested in giving you healthy choices. It's just making good processed, cheap food that you eat a lot of, and that's something that we have to rethink about our society. Is that how do we change our food supply? How do we make the norm healthy? It was up to me every time you go to, let's say, McDonald's, is that you order your Big Mac, but it comes with a salad bar, unrestricted, without dressing, would be one way of doing it. But anyways, that's you have to figure things out for yourself with the best choices. But you have lots of options here, and I'm so impressed that one size does not fit all, and I'm really amazed at people saying, "Well, I should be able to do this naturally. I shouldn't need to do these sorts of things." Well, our society has changed. Um, I think this enables you to do the other parts. The part I see is that, to lose weight, you have to caloric restrict. To keep the weight off, you need to exercise. And to keep out of the nursing home, you have to lift weights and do balance training. Um, Rad, what happens over the age of 65? What percentage of people fall over the age of 65? Do you remember that? You're the guy that knows all
Yeah, it
this.
was about one third over 75. 65 to 75, I don't have the number, but it's even 30%, one and third is quite a bit. And of those who do get hospitalized, half of them, get more frail over the time. Let's say if you didn't use a walker, you use a walker. If you use walker, maybe you have to use a wheelchair at some point. So the quality of life is really affected from falls. And cause of death as well. Something that we talk about what kills people: heart disease, cancer, Alzheimer's, and then above the age of 75, accidents, falls, those sort of things.
Thanks for sharing that.
Of course, it's a bit grim, but we're trying to do all we can to prevent that and
But
as many people as possible.
there's just this weekend, there's a 94-year-old gentleman who just completed his 30th marathon. He just completed, I think it's the 17th time he's done the Rome Marathon. 94 years of age and has done 30 marathons. And he says, keep walking, keep moving. Amazing. And so you have to decide what to do. I know what I'm going to try to do. Um, I keep joking is that my wife a year or so ago entered me in the Toronto Half Marathon. I finished towards the end, but I got this medal about months later said I finished. I think I finished a second in my age group. I was at the back. Only reason I finished second was my wife by accident put me, or maybe purposely, people at the age of 75 years of age. Um, so I hope when I get to 75 years of age or plus, I can still do the Toronto Half Marathon and defend my medal at that point in time. So there you go. Wonderful. Tell us more about how we can use this magic here to take away the appetites and make us stronger in our healthy habits.
This is a comparison slide of just Ozempic, Wegovy, and Mounjaro in terms of its effects. So as mentioned, Ozempic and Wegovy have the same ingredients, so semaglutide, whereas Mounjaro is tirzepatide. And Ozempic and Mounjaro is mainly advertised for type 2 diabetes, but of course can be used for weight loss too. And Wegovy is purposely made for weight loss. But all three of them have kind of similar, some overlapping effects. So for example, they can help improve or regulate blood sugar. They can help with weight loss, which can lower risk of cardiovascular events. It can decrease appetite. Mounjaro increases insulin sensitivity. But yeah, the main difference between the three of them is really the mechanism of action. So Ozempic acts on the GLP-1 receptor, while Mounjaro acts on the GLP-1 and GIP receptors. And the dual agonism that Ruhi mentioned before can help with more effectiveness in regulating blood sugar and then the weight reduction. And we'll go over more of its effectiveness later. But yeah.
So,
Yeah.
very, very important. If you just go back one way, so Ozempic, Wegovy, the exact same drug, semaglutide. They just have different names. So this is more for insurance reasons issues. So many insurance companies will allow you to go on Ozempic for diabetes, and the Ontario government will pay for it if you cannot get your blood sugar to target, and you're taking other medications like metformin. So the government has some certain rules that people have broken in the past, but there's laws and rules about that. Um, and Wegovy is semaglutide, and that's been basically sold for as a weight loss drug. It's the exact same medications, and you sometimes need a higher dose to get the weight down. Mounjaro has two names in the States, one name in Canada right now, and it can be broken up between for weight loss and for diabetes. But the same drug works well. In fact, the drug works better at reducing weight before you have diabetes. As the body ages and wears out, your pancreas wears out, it works less well. So, um, it's funny, we don't give, your car first oil change at 65 years of age. But yet many of us will say, well, I'm just too busy. I got too much to do. I'll do it later. I should do this naturally. Well, it only gets harder. It's more difficult, and you certainly wouldn't drive your car at half inflated tires for all its life. Yet we do that to our bodies, and think that nature, our body has a remarkable ability to adapt for so long that it wears out. And I've seen so many people who lives are very poor quality. The golden years can be the golden years. Um, and this is one way of doing this by controlling your weight, controlling all the activities that you're doing and preventing yourself from falling. Um, I think I'm just going to stand on one foot for the next little while you keep going and keep going. So I see last week I'd fall. Now I can actually stand on one foot. I'm closing my eyes. I can do that better now. So I'm just working on my balance training too as well. Keep telling us more while I work my balance training.
Okay, now we're just going to talk about how to store it and kind of how long each pen lasts. So for Mounjaro, each medication pen is intended to last in total for 4 weeks at that dose. So say you were using a 15 milligram pen and you actually wanted to use the highest dose. So you were using 15 milligram dose with the 15 milligram pen, then that means your pen would last for 4 weeks. But by using the counting the clicks method, that can basically increase the length of time that your pen will last. So it will last longer than the 4 weeks that it's supposed to last. And the manufacturer states that the open Mounjaro pens have a 24-month, so 2-year shelf life when stored at 4 degrees Celsius. So even if you do count the clicks, your medication will still be effective, even past the 4 weeks. So on the bottom, we just have some example scenarios to kind of go over how long it would last or how long you would use your pen for if you use the counting the click methods. So if you used a 15 milligram pen and you only wanted to do a 7.5 milligram dose, then you would use 30 clicks per dose because the 15 milligrams is 60 clicks in total. And essentially your pen would last 8 weeks because a 15 milligram pen with a 15 milligram dose would last 4 weeks. but you're having the dose, so it would last for twice as long, so 8 weeks. Similarly for the 2.5 milligram dose, if you're using the 15 milligram pen and counting the clicks, then it would last for 24 weeks or 6 months, and we've just included the calculations if you're interested, but you're essentially just dividing the dose by 6, so it lasts 6 times as long.
And there is some preservative in there, and what you do is you keep it in the fridge. Is the best way of doing that. You don't keep in the trunk of your car. You don't heat it. You don't keep in the microwave. Um, but it's so and then it only comes with a limited amount. It only comes in what I think 4 needles. I'm sorry, these are non-needles. These are just you just have to reuse some of your needles in this circumstance. And as long as you keep them clean, that's fine. People are doing this for years. Um, or you can buy extra ones if you'd like to.
We're going to be transitioning now to talk about tirzepatide for Mounjaro's effects. So first, we're going to talk about its effect on appetite. So this graph is basically just showing its effects of tirzepatide, so Mounjaro, and semaglutide, so say like Ozempic, on overall appetite. So essentially, the study just basically measured their overall appetite score. So they measured it 1 minute before a mixed meals tolerance test. Basically, the mixed meal tolerance test is just essentially kind of like a standardized liquid meal, where they're measuring their blood glucose. But the main point is that they were asking them how they kind of rate their hunger, how satisfied they feel, how hungry they feel, and how full they feel, and how much they think they could eat before undergoing the test. And essentially, what these higher VAS score mean is that the higher the score, the lower your appetite. So we can see that for tirzepatide in dark blue, and same with semaglutide, it's a lot higher than the placebo, which suggests that it is like effective at reducing appetite. And it's been found that Mounjaro can help decrease hunger, improve how satisfied and full you are, and just decrease appetite.
Yeah, one thought I have on this now, when I'm looking at this, it kind of tells me that the appetite suppression of Mounjaro is quite similar to the 1 milligram of semaglutide. So in that aspect, it doesn't seem to be that superior, right? Of course, similar to placebo, they both reduce your appetite. In fact, that's one of the main ways, going through the brain and trying to help with the glucose reduction and weight loss. But so on that front, it does not win. We're going to talk about some of the other fronts and some of the other efficacious data. The rest of this is for healthcare providers. We're going to give some data from the 2021 trial of Mounjaro versus semaglutide. One is that they did a body composition study. Now, I looked into the methodology of this to see if this was a DEXA scan, if it was a body composition scale, the ones that are commercially available. It was something that I was not familiar with. Maybe, Ruhi, you might have heard. It was something called a BDOP, something similar, where it measures the volume of your body, and it estimates how much fat mass you have and how much fat-free mass you have. But regardless, their key takeaway was that compared to the semaglutide dose of 1 milligram, the Trizepatide at 15 had more of the reduction of weight loss from the fat mass, and more of the fat-free mass was preserved. So you can see the data here, that when we start on the bottom, the left one from this placebo, we started with the fat-free mass of 57 kilograms, and we went down to 55 in the tirzepatide, but the percentage total went higher. Now again, the percentage is not the most important thing. The key takeaway is on the right, that you lose less muscle mass slightly, it seems, on the tirzepatide than semaglutide, and more of it is the fat mass. Now, Dr. Curnew, if you're familiar with any other data, perhaps more recent, this was from 2022, or Ruhi, please let us know as well.
No, I think you summarized it quite well. And what I always remember is that roughly when you lose weight, a third of weight loss usually is muscle, 2/3 is fat. But it really depends what your starting weight is. If you're really overweight, you have more fat to lose, so you lose a higher percentage of fat. If you're skinny to start off with, and the part that worries us the most is that you want to lose that last 5 to 10 pounds because you want to look good for I don't know, your graduation, your wedding. Um, that's what really worries me because you're going to lose more muscle. Losing muscle is never a good thing. So these drugs are designed for medically reasons because your weight is affecting your health, and that means you have way too much fat on board, um, and you don't want to lose muscle. And you will lose muscle with these medications. And basically, we think by getting more protein, somewhere between 1 to 1.5 to 2 grams per kilogram, and resistance training, that you'll lose less muscle. We think that's the case. The studies to prove that are limited quality, but we're still going to do that anyways. But um, you don't want to do this for cosmetic issues, you want to do this for medical reasons, and you need to discuss that with your doctor. So I'm not interested in this drug as a cosmetic drug.
Mm-hmm.
I'm interested in this drug as a medical drug to prevent heart attacks, congestive heart failure, cancers, osteoarthritis, hip replacements, falls, um, atrial fibrillation, goes on and on. Um, so I'm using it for a medical reason.
Yeah. Thanks for sharing that. Actually, that last point is very important. Now, comparing weight loss with the Trizepatide different doses and semaglutide 1 milligram, you can see the bars here. If anyone is more curious, pause the video and take a look. In a sense, more people could achieve targeted weight loss with the Tirzepatide ones thanks to the dual agonist nature of that medication. Next one, A1C, HbA1c, is a reminder, if that's a new term for folks, that is hemoglobin A1c, how much sugar is attached to your hemoglobin levels. And so we can see the percentages here, quite small, but I actually have the numbers here that I did the math here, lots of math tonight, that the reduction, so comparing the 15 milligram of Trizepatide with the 1 milligram of semaglutide, the A1C reduction difference was 0.6%. So you got an extra 0.6% reduction. But it's really the weight loss that does the lion's share of work, where the difference between the maximum dose of Trizepatide and 1 milligram semaglutide was 6.2 kilogram. How much is that in pounds? It's a lot. So 6.2 kilograms is a lot. Since you can see that when it comes to metabolic syndrome, it's both the insulin sensitivity, getting the sugar down, that helps, and the weight loss. And there's also other data that we don't have here, that your liver fat is improved and some of the other metabolic parameters as well. Speaking of other metabolic parameters, the lipids, Dr. Curnew, the expert at this, can see some improved values. Now, are the percentages as good as other things like statins? This is not the purpose of that, to be used for that target. It's to be used as an adjunct therapy, and has a different purpose. But you can see it does that as well, which is no surprise. When you lose weight, you get these benefits in your lipid parameters as well. HDL goes up, LDL goes down, VLDL, which is also atherogenic, total cholesterol, and surprisingly triglyceride as well. So you can see all the atherogenic protein, atherogenic lipoproteins that are causing problems are also going down.
So you can see that LDL cholesterol is what we concentrate on for vascular protection. The effect is small but present. You're talking about
Yeah.
a 5 to 7% reduction in LDL cholesterol. You can easily get a 60% reduction of LDL cholesterol by using high-dose statin therapy and ezetimibe. So
Yeah.
I'm not using these drugs to lower your cholesterol. It's a bonus.
Yeah.
And you can see that weight reduction lowers triglycerides and eating well. And mostly people who go on these drugs eat better. They have less tendency to eat junk food, less processed food. They eat healthier choices, and that is a reflection of triglycerides and other lipid parameters. And I'll remind people that basically 80% of your cholesterol in your bloodstream, the LDL cholesterol, is more genetic factors, 20% are dietary factors on average. So quite variable, but these are the numbers for most North Americans. So a nice effect on cholesterol, small effect, but real.
Of course. Now, blood pressure, very, very modest. Just an adjunct slide for anyone who's curious. You can see that there's a bit of a reduction in there as well. Now, something that was a bit of a curious question related, the pulse goes up a little bit. I don't think there's a concern, but it was an observation that you can see that with a variety of different GLP-1s.
Yeah,
They
so
call,
that is actually a potential concern. All these drugs are known to increase heartbeat by a few beats per minute, and it's something we have to keep an eye on. Uh, I don't get overly excited about it, but they do increase heart rate.
yeah, yeah. All right, some safety data. Now, the bottom line is that the adverse side effects, such as um, feeling nauseous, vomiting, diarrhea, are quite similar across Mounjaro, Wegovy, and Ozempic. Of course, reminder, Wegovy and Ozempic are the same medication. Um, but roughly, the bottom line is that roughly 5% of patients cannot take Mounjaro because of some adverse event overall. So nausea, you can see, is the most common one at around 5%, and the majority of it is mild to moderate with very few severe ones. You can see that shown in the red bars on your on the top of the bars in here. The vast majority is green and moderate. Now, one thing that's important to say, actually, have to be two things. What does this green mean is very subjective. For some people, any level of adverse event is too much, and they would not like to continue the drug. And the second point is you can do things to control it. As you said, Dr. Curnew, having different food choices can help alleviate some of this concern. Not in everyone, of course. Some people still make those changes. Really, you probably have a lot of personal experience with this, and they
Yeah,
still
I
have some of
mean,
those issues, right? So, but by
oh
and
yeah.
large, around 5% have trouble to the point where they have to discontinue. That's for nausea. Vomiting is not as severe. You can see the percentage. That's a 5% line, or about 1, 2, 3% overall. Uh, patients, and you can see the different doses all compared to semaglutide 1 milligram on the right. So at the 5 milligram dose, I'm seeing slightly smaller bars compared to semaglutide 1. Whether that's statistically significant or if it's clinically significant, I'm not sure, but this is the data. And the last one is diarrhea, slightly more frequent than vomiting, but nonetheless one of the adverse events. Again, vast majority are mild and moderate. Roy, what's your experience been with people who control and have been able to control the adverse events? Maybe they tried it again and went back on the medication.
No, yeah, absolutely. So I think with Ozempic and Wegovy specifically, from what I've heard from patients, is that when they're eating quickly and larger portions per meal, that's usually when the vomiting happens and the nausea is worse as well. And also the kinds of foods you're having, like higher fat, more processed foods, even ultra processed foods, typically are associated with, more nausea, more, gastrointestinal symptoms in general. So eating slower, having smaller portions, smaller meals throughout the day is a better option. And then yeah, the kind of food that you're eating as well plays a huge role in your symptoms. And also beyond that, the symptoms, at least from just my personal experience with patients too, have shown that over time the symptoms just do get better. Sometimes that's a few months, sometimes that's, a few weeks, but it really varies from person to person. But if you stick through it, it does usually get better. Patients that we've followed up with that have been on semaglutide for 2 years now, some of them report no side effects when they had quite severe ones initially starting. So that's something to hold on to hope for.
Yeah, interesting. And this data reflects it to some degree when you can see the weeks on the x-axis. You go to 4 weeks and you get slightly smaller numbers. Okay.
What's kind of interesting is that you're saying 5% of people can't tolerate the medication long term. Our experience is much higher than that.
Yep.
And I think when you put life to the equation with all the stresses and things of that life, the cost factor in this and the lack of exercise and wanting to still eat some of the foods that you had before and not eating less, it makes it harder. But I'm also impressed the amount of transformative how it's changed people's lives as well. So this is one of the drugs that can actually change people's lives. Um, and I'm also impressed that if you're not prepared to do the other things, then you're not going to have a durable long-term result that you're going to be happy with.
Of course. And some key takeaways. We saw that dual antagonism um, gives you a greater A1C reduction when you compare Mounjaro with semaglutide or Wegovy. you get significantly more weight loss. Again, comparing, it was 6 kilogram extra net when you compare the 1 milligram of semaglutide with the maximum dose of tirzepatide, 15 milligrams. We didn't talk about the major adverse cardiovascular events, but that was not a primary component of the SURPASS-2 trial, but they mentioned it nevertheless. You can see it on the screen. The gastrointestinal effect, the most common adverse event, is here. The more severe and rare events like pancreatitis, I looked at the chart. The events were very small in this trial, 0, 1, 2, 3, not enough to make any judgments in terms of if there's a difference between Mounjaro, semaglutide, etc. But it's much less. I'm sure observational data and post-medication studies are slightly better when it comes to answering those questions. On top of the 5% value, the 5% number of people who cannot continue the drug is from the trial. Real life, much higher. I don't have numbers in front of me. I wish I had looked that up.
So what's interesting is that there is roughly a 20% reduction in cardiovascular events with these drugs, mostly congestive heart failure. And there is a small reduction in lousy cholesterol, 5%, a bigger reduction in triglycerides. I'm using these drugs to promote a healthier weight. That's what, and so that you can exercise, that you can actually eat less processed food, add more fruits and vegetables to your diet. And that's how I see this fit into that.
Of course. And one last one, Rui, I'll pass this off to you. What's the last key takeaway?
Yeah, so this was just another kind of bottom line that we wanted to mention. So, overall Mounjaro, we've compared that 2.5 milligram dose to 1 milligram Ozempic. So when looking at cost, it's less costly for a more effective outcome for diabetes and weight loss management when we're considering the biggest pen size. And of course, this is a simplified kind of bottom line key takeaway, but ultimately it poses, a great option for people who may be struggling with weight loss and have tried other therapies that haven't maybe had success with that. And I'm sure Dr. Curnew can speak more to some of this key takeaway too.
Yeah, I think you can spend $1,000 a month for these drugs, or you can spend $50 a month for these drugs. Um, for some people, it's going to be lifelong therapy. Most people will want to cut back on the medication as time goes on, but the trials all clearly show if you stop the medication, most people will regain two-thirds of the weight back relatively quickly in the next number of months. But if you now decide, okay, I've learned some new behaviors, I'm now going to go to the gym with Dr. Curnew. We're going to spend 7 to 14 hours in the gym. And tomorrow morning at 6 o'clock, I'm going to be lifting weights. This morning, I was playing some squash and also lifting some weights. And I hope tomorrow night I'll gonna go do some stairs, the Shadok stairs. We'll see what happens. So right now, I am not taking the drug. I did use Ozempic during the pandemic, and I found that a game changer. I have the ability to go back to that on an intermittent basis if I want to. Um, and I have taken a few Rybelsus pills every once in a while during difficult times. Rybelsus is an oral form of semaglutide. Um, and but right now is that I feel more in control. Some days I'm going to feel more in control, and I'm going to go back to the drug. But I'm going to hopefully teach myself new habits. Um, I'm seeing too many people saying, "Well, I should be able to do that naturally." They haven't, um, and I'm seeing that over 70% of the people I see weights are adversely affecting their health in a negative fashion, and it doesn't have to happen anymore. You can do something about that. And I hope people keep an open mind, try different things.
Wonderful. Any last thoughts from anyone? Morgan, Rui, yourself? All good?
I
So
think, yeah, the one thing I also thought of as Dr. Curnew was mentioning, stopping the medication. There's been some preliminary findings to show that titrating down your dose. So if you're on a higher dose of, Wegovy or Ozempic and potentially even Mounjaro, lowering that dose slowly and allowing your body to get used to that and adjusting your lifestyle and diet as that goes by, it might keep the weight off for up to 6 months or even for longer. So you can always play around with the doses, as we've mentioned, counting clicks going up in dose, but also coming back down if, cost becomes a barrier or you're losing muscle mass, which is, we have found that patients who are of lower weight or of a lower obesity class typically may lose more muscle mass than those of a higher obesity class. So if you're reaching those weight goals and you're considering maybe it's time to find a maintenance dose or time to see if I can come off the medication and maintain this weight, slowly going down and would be the best option.
Reminded there are two trials called Broad and Direct that put diabetes into remission by losing 20 to 30 pounds. The success rate was about 20 to 30% at a year, but at 5 years, the long-term success rate was 5%. And so to me is that you need to recycle. It's like any sports franchise. You have winning seasons and bad seasons, but you keep getting better. Um, right now, I'm having some dates right now to have at my sweet tooth. It's not the same as a chocolate chip cookie, but it's a better choice. It's not a perfect choice. And I just think there are better ways of doing things at this stage, and I hope you allow us to explore that. Looking at body composition, I've managed to put diabetes into remission. I don't know for how long, but there are good times and bad times. So right now I'm up 5 pounds more than I want to. So I want to lose 5 pounds of fat and gain 5 pounds of muscle. I can't wish that. It's a tough journey, but I'll keep working and enjoying the fact. And those who want this weekend is the CN Tower climb. In the end of April, there's the Paris to Ancaster Mud Feast. I'm really looking forward to that. I'm going to put myself into a 70-kilometer event, and it's half road, half mud. Um, and my goal is not for someone to tap me on the shoulder, sir, in your last place, you'll have to stop. That happened once, but last year, I spent hundreds of dollars fixing my bike again from the derailleur stuff, and I had to push the bike up the hill at the end. But um, I just think there's so many opportunities here to be healthier. And this is a wonderful slide about getting your brain, your maps, and things of that nature. And I really don't expect insurance companies and governments to pay for everything. There are certain things, and I worry because if I just used these drugs in my practice at $250 a month, and you have 5,000 patients, three-quarters overweight, you're spending over $10 million a year on just one drug. Um, I can't do anything else in my practice. I have to use these wisely. But if you do things smartly and you're doing your share, I'm doing my share, then we can find a way. And I love these drugs, and I love um, lifting weights. I love playing squash. I'm not very good at any of these sorts of things, but I'll keep trying, and you should too. Is it time to do some push-ups tonight?